Russia sparked the past, 1917. First workers' revolution, first revolution in history. Working people forced, the bosses backed against the wall. The first step taken for the better life for all. It's a shame, crying shame, where the past is buried and a victory unnamed. It's a crying shame. When a history books talk of kings and men of fame, and in another country, workers rose again. 1919 in Berlin, but they didn't learn the lessons from the Russians that they should. Revolution drowned in blood. It's a crying shame, but the lessons stay. It's a crying shame, the lessons play now. All things are possible. Ooh, yeah. Oh, yeah. Take it. Hunger of the 30s, hunger of the 30s back up.
Well, good evening, everyone, and a very warm welcome to tonight's online forum. We have tonight the second in a series of online forums hosted by the Lothians branch of the Scottish Socialist Party discussing the case for the National Care Service. My name is Colin Martin. I'm one of the two national co-chairs of the Scottish Socialist Party, and I'll be cheering for you all tonight. Now, this is obviously the second in this series of forums. So last month, some of you may have been here when we had a fantastic panel heard from the author Madeline Bunting, Professor Jane Lethbridge of Greenwich University and the PSIRU. We had Tam Waterston of Unison and Roisin McLaren from the SSP, all discussing that case of the National Care Service. And tonight is no different. We've got another fantastic panel lined up for you tonight. And so here to speak to the case for the National Care Service and to reflect on some of the questions you might have, we have Colin Fox, a former Scottish Socialist Party member of the Scottish Parliament for the Lothians, and now national co-spokesperson of the SSP. We have Dr. Allison Pollock, the leading medical expert and member of the Sage Advisory Committee. And we have Professor Luke Clemons, Cerebral Professor of Law at the University of Leeds. And a reminder that tonight's event is an interactive one. If you have any questions about the case for a National Care Service, do send them in. And the second part of our meeting, we'll see our panel given the chance to answer and respond to some of your questions. If you're watching live, you can type in the comments in the live stream, either on Facebook or on YouTube. And a member of our fantastic tech team will pass them along to myself and the speakers to address in the second half. If you're watching after the event, a repeat broadcast, then obviously we won't be able to put them to the speakers live, but do continue to think about how you might want to engage in the conversation. And if you do have any questions ongoing, do remember you can get in touch with the Scottish Socialist Party on Twitter, online, our regular stalls across the country, where we'll see what we can do to help you out. So let's crack on then, the National Care Service. Tonight we'll be looking at what it would look like, how might it operate, and why is it so important? Well, let's continue to find out. Before I introduce our first speaker, however, those of you who were present last time or have subsequently watched our first forum will recall that we've been in contact with Derek Healey, the former chief executive of NHS Scotland, and currently the chair of the new independent review commissioned by Holyrood to examine the National Care Service, the care sector as it stands, and what reforms might be on the table. Now, Derek Healey wasn't able to be with us tonight, but he has offered to answer some of the questions we didn't have time for last time. So I'm pleased to present now a short video from Derek answering some of the questions you asked last time that we didn't have time for about the National Care Service and the independent review.
Hello, I'm Derek Healey. I'm the chair of the Independent Review of Adult Social Care in Scotland. I'm grateful to you for your interest in the review and for the questions that you submitted. We kicked off our review in September and we're due to report in January of next year, and so There are some things I can't yet be definitive about, but I'll give my best shot at answering the questions. So the first question asked was around the National Care Service and what that might mean. I think we're beginning to see some real opportunities around the creation of a National Care Service. To begin with, to change the narrative around social care. What's it for? And we'd like to move that away from thinking about social care as something that a service that people get when they experience some kind of crisis in their life, towards something that's much more about support for people to live the lives that they deserve to live, that they have a right to live. And we'd like to change the narrative away from social care being seen as a burden on society and towards it being an investment. And so I think the creation of a National Care Service can help us to do that. Other opportunities around the National Care Service are to embed a human rights-based approach to social care, to really recognise the needs, rights and preferences of people who need some support. And we've been trying to put those needs, rights and preferences at the very heart of everything that we've done in the review. Also some opportunities around consistency of approach, a single national approach in Scotland around things like eligibility and access. We need to remove some of the variation from our current system, introduce some stronger national standards, introduce national oversight of outcomes, of quality and of finances. You asked about whether social care in Scotland might ever be free, and we're certainly looking at charging for services. That's one area where there's currently a lot of variation. And so we're certainly looking at that, and we're also looking at ways to keep public money in the system and to be sure that we can really get a return on our investment of public money. Your second set of questions were around publication, and so the report will be made available to the Scottish Government at the end of January. My strong expectation is that they will publish it in full. We've got in excess of 100 written submissions from people, from organisations rather, and those submissions that came in from organisations, again, I would expect to be made available. We also got quite a few submissions from individuals, and there we're on, I think, trickier territory, and I think we would only make those available with the permission of the person who made the submission to us. But we'll try and make sure that this is all done as transparently as possible. I think there's an opportunity for our work to inform the writing of manifestos in preparation for the May election, and so I would expect everything that we've recommended to be fully in the public domain. And then a third set of issues really around broader learning from the pandemic, specifically around issues like PPE. And I think there's no doubt that the way in which the current system is organised, the fragmentation in it, did not help in the managing of the pandemic. And so again, a real set of opportunities around the creation of a National Care Service in terms of bringing national organisation and resilience, managing risk at a national level, sharing expertise across the system, that I think undoubtedly would have helped us and will help us in the future. So thanks again for your interest. I'm grateful to have had this opportunity to talk with you. I hope that's been helpful. Thanks very much.
Our thanks to Derek Healey. If you're just tuning in, that was Derek Healey, who is the head of the Independent Review, reviewing the care sector, and also the former chief executive of NHS Scotland. Now, as I say, if you're just tuning in, we're about to hear from our fantastic panel. Tonight we have Colin Fox, the former SSP, MSP for the Lothians and national co-spokesperson of the SSP. We have Dr. Allison Pollock, director of the Institute of Health and Society at Newcastle University. And we have Professor Luke Clemons, Cerebral Professor of Law at the University of Leeds. It's my pleasure to introduce in a moment our first speaker, who is going to be Colin Fox. But before that, just a reminder, tonight is an interactive event. If you do have questions you'd like our panel to address, to answer or speak to, do send them in. I see some already coming in. So do comment them in the live stream, whether on Facebook or YouTube, and then our tech team will pass me to put to our panel tonight. Colin.
Thank you very much, Callum, and thanks for that kind introduction. I'm delighted to be here, and I want to thank everybody for checking into this really important debate and really important discussion. I'm particularly grateful to Professor Clemons and Dr. Pollock for joining us, and I look forward to hearing what they have to say and adding to the intelligent contributions that we're hoping from everybody tonight. It's clearly a landmark day in the fight against the COVID-19 pandemic, with the first vaccines being administered. And so hopefully we can begin to look and see light at the end of the tunnel and give some thought perhaps to what we want to leave behind from whence we started. And for me in Britain, there could be no more fitting legacy from this traumatic year-long experience than establishing a national care service, one that's free at the point of need, publicly owned and run, and fit for the 21st century. A reform, I think, that in my view is well overdue. And I'd like to start my brief remarks with some quotes of other people in this debate, if I can, to offer some kind of context to what we're studying here. And here's one quote I'd offer you to begin with. After 2 decades of talking about it, we do not have a fair and properly resourced adult care system in this country. And that was a quote from Sir Simon Stevens, the Chief Executive of the NHS and the MAR programme in July. The second quote goes like this: of all the missteps in tackling coronavirus, the epidemic in our care homes is the worst. In Scotland, half the 5,000 deaths who've occurred there. That's from the Financial Times. Another newspaper said no other issue is as important as the change needed in the way our care homes operate. That was the Daily Record in April of this year. The care home COVID-19 deaths are the greatest single failure of devolved government since the creation of the Scottish Parliament in 1999, said Commonweal. And this is my final quote: we failed to shield the vulnerable because social care services are fragmented, privatised and underfunded. And now the news is grim. This is a truly appalling situation. And that was from Dr. Allison Pollock herself. You might recognise her own words, I dare say. And I'd like to start by saying there's a case for a national care service that goes like this. 2,500 Scots died of coronavirus in Scotland's largely privately run care homes for the elderly that weren't fit for purpose. And you're entitled to ask the question in 2020, did COVID-19 cause this crisis? And the answer, of course, is no. The situation was bad way before that happened. COVID-19 was merely the straw that broke the camel's back, or if you like, where the public's patience finally snapped over the shameful provision of adult social care services in this country, a model widely known as unfit for purpose. And since we're near Christmas, if Oliver Twist was a tale of childhood neglect, then 2020's COVID experience has exposed an equally appalling elder neglect in this country by private institutions running commercial lines for profit that should have no place in the provision of care in the 21st century. Far too much of this service belongs to the Dickensian era of neglect, where it should be life-affirming and full of stimuli. Privately run services, I repeat, nearly 70% of the care homes in Scotland are privately run. 70%. Commercial companies which run their care homes for profit. And I came across this the other day there. This is a advertisement, a brochure for Fidra House in North Berwick, part of the Randolph Hill group. You probably can't see it. But they're asking for £1,300 a week to look after people in residential care, nearly £70,000 a year. HC1, who are the biggest private providers in this country, in Britain, with more than 600 care homes that they operate. People will remember that Home Farm Care Home in Skye, Portree in the Isle of Skye, where 20 people died in June this year. That care home was taken off of HC1 by NHS Highland because of the inspectorate's report shown neglect and appalling circumstances that the residents faced there. So commercially run care homes run for profit, for me, are a model that are no longer appropriate. They're not fit for purpose in the 21st century. And this is an industry that depends on human beings looking after other human beings with empathy, with compassion, and above all, professional pride in their work. And yet it's built upon slave wages and the exploitation of this dedicated staff, who themselves are often subject to abuse by their employers. When 1/3 of all care staff leave the profession each year, feeling downtrodden, demoralised and despairing, something has gone badly wrong. There's 148,000 people working in social care in Scotland. So by that proviso, there's nearly 50,000 who leave the service every year, demoralised, despairing at what they found to be the case and unable to deliver the kind of service I'm sure they wanted to deliver. So essentially, this lethal pandemic has exposed for me the choice between a privately run system and a public provision. And I'm reminded, in 1948, the country looked at its healthcare. And before 1948, I have to say, our care system today looked a lot like the NHS was before 1948. That's why we changed it and introduced what is, after all, Britain's most beloved institution. Our care homes are not beloved. The family members at Home Farm Care Home in Isle of Skye, where 20 residents died, didn't cherish the institution their loved ones were placed in. They were horrified and disgusted at those conditions. And for me, this is a central debate between whether private provision is appropriate, or in this day and age in the 21st century, the people of Britain and Scotland want to see a publicly run service. And the Scottish Socialist Party is in no doubt whatsoever where we stand in this conflict. We've supported the idea of a national care service, free at the point of need, publicly owned, fit for the 21st century for 20 years. And in the last 6 months, because of the COVID experience, we've been out campaigning full time. And at the forefront of the campaign, I have to say, to ensure that we have a care service as I described it. We've had street stalls petitioning in Edinburgh 4 days a week. This is our second national forum, as people know. We've been round the doors leafleting, online and leafleting in the street. And I have to say, I'm absolutely bowled over by the strength of support that there is amongst the public for this reform. It's widely overdue, long overdue. And I think it's in keeping with what people in this country are looking for from their care provision, for their elderly relatives, for their family members in the 2020s. That's what we've done. And the Scottish Socialist Party, Callum, has commissioned an opinion poll from Panel Base, which will be conducted in the second week of January, ahead of Derek Healey's review that you mentioned here before, where we want to test public opinion and to see to what extent there is support for a national care service, free at the point of need, where you don't have to pay £70,000 a year for elderly care, that's publicly owned and not run by companies like HC1 based in the Cayman Islands, that's fit for the 21st century, that takes care of our residents and it takes care of our staff, the people who look after those residents. And I'm confident that that opinion poll in January will coincide and show that there is enormous support for such a demand. And I have to say that for me, you get a strong sense in this debate, strong sense campaigning, that a national care service, free at the point of need, publicly owned and run, fit for the 21st century, where the staff are properly looked after, as well as the residents. This is an idea whose time has come, and this is the time for that idea. And I very much want to leave you with those remarks here tonight.
Fantastic. Thank you, Colin. If you're just tuning in, that was Colin Fox, former Scottish Socialist Party MSP for the Lothians and national co-spokesperson of the Scottish Socialist Party. I'm pleased now to introduce our next speaker, who is Dr. Allison Pollock, who is the Director of the Institute of Health and Society at Newcastle University, as well as having formerly been head of the Public Health Policy Unit at University College London and Director of Research and Development there. Happy to introduce Dr. Allison Pollock.
Hi, thanks very much for inviting me, and thank you, Colin, for that introduction. I'm not going to spend very long because I've really gate crashed this meeting, more because it's a cause that I feel very passionately about, and I'll do anything to help support. So I want you to know that. I mean, for me, care is a continuum. And one of the great tragedies is the way that a lot of what we call now social care was taken out of the National Health Service. So I don't think care starts and ends in primary care or in hospitals. I think it's a continuum, and we need to think of that. And you're absolutely right, Colin. The tragedy of COVID was that of all those people who died in nursing homes, only some 10% in Scotland, when they published the data in June, actually got into hospital. And I think that's a terrible figure, because in England it was much higher. It was around 26%. And we know what was going on in these care homes. The GPs weren't going in. They were doing Zoom calls. The staff were underfunded and overworked and very frightened. They were also bringing in a lot of agency staff. And there were high vacancy rates of 20 to 25%. And that was before COVID struck. And the vacancy rates were even greater afterwards. So you really had a situation where I have no doubt that the one thing that was missing was really good nursing care in these nursing homes. And not because the staff didn't care, but because they were too stretched and there wasn't enough support. So people were isolated in their rooms, and I have no doubt many of them died miserable deaths and needless deaths without the comfort of their family, and probably from dehydration and just being very, very sick and very, very frail. So I think it's unconscionable what's happened in nursing homes. I think there was absolutely no need for primary care should have been there. And the other thing that we haven't touched on is the staffing. We know that the staff in nursing care and domiciliary care are amongst the lowest paid on living wages, many of them less than £8 an hour, many of them with no terms and conditions. And yet these staff were being asked to look after the frailest and sickest in our society and the most vulnerable. And what should have happened in the NHS is that the staff in the NHS, many of them, not all of them, many of them were working hard, but many of the services had been stood down. And I know quite a lot of teams that were not working at full speed. So they and the nursing staff, the nurses who were being graduated, the students and the medical staff, students, instead of being put onto wards that were empty and they had nothing to do, there should have been a massive redeployment. And this was an opportunity for the government to nationalise the workforce and get it right. The government has still failed. What it should have done is double those staffing numbers and sorted the space. This is a nonsense that 9 months later, relatives are still not getting access to the people that they love, and visits are so limited and now being tied to testing. It's an absolute nonsense. These problems were solvable with good staffing, with good space, with a lot of, have there been a lot of discussion between the staff and the residents and the carers. Instead, the relatives were shut out, and this is absolutely appalling. And I'm glad to hear that Derek Healey is going to put human rights at the centre of things, because they've certainly been forgotten in the last 9 months. And Scotland is supposed to have a fantastic record on human rights and is doing a lot to try and embed human rights into children and to services. But this, I think, is a catastrophic failing on the part of a government. This could have been fixed. So what I'm arguing for, I guess, is not just a national care service, but a national health and care service, because it's a continuum. There should be no break and no fragmentation. I think Colin's absolutely right. The report on people dying and deaths in nursing homes, I'm trying to remember it, Colin, but it made a great deal about the fact that size was important, and it was a significant factor. The 64 big, large nursing homes had the majority of deaths. But the one word that was missing from those reports was the for-profit private sector and the role of the large corporates. As you say, I find it astronomical that residents are being charged not just £1,100, but up to £1,800 a week, when that resource could be pooled and could be used much more efficiently and effectively. I mean, I don't support means-tested care. I think care should be free, as you say, Colin. And I think that means then you have to take it out of the hands of the equity investors and the large private corporates. So if we really want a national care service, we really have to have a very strong vision and a strong plan. And of course, it needs to be democratically accountable to local people. And that is exactly what we saw did not happen. There was no parliamentary or democratic accountability for what was happening in long-term care. And we're still failing. You know, there's nearly 500,000 people in long-term care, but there's more than 1.5 million, 2 million in domiciliary care across the UK. And there are about 1.5 million care workers. They're all being failed. I'm not going to go on too long, but just to say, I do think it's important to have human rights. I think care is a continuum. And I think also it extends to housing. One of the other aspects is the preventative care, the sheltered housing, the warden-controlled housing, all those other parts of care that are important, that enable people to live in dignity and with their families as well in the community. And these are all the things that have been whittled away through successive cuts over 20 years. And I'm aghast at the hundreds of billions of pounds the government is squandering on mass testing. It's going to be spending the same amount on vaccines. We do not know whether these vaccines are going to be effective, but we certainly have a lot of evidence as to what would be effective to make a good health and social care system. So I think I'm going to stop here. I'm happy to take questions. Thank you for inviting me. I haven't submitted to Derek Feely's, and I really feel now that I should. And thank you for alerting me to it. And I would really, it was a great pleasure for me to work with Professor Luke Clemons very early on in this pandemic, and his perspective on vulnerability and human rights is so vital, and it's very vital that it's encapsulated in the policies and the way we think. It's not just about the law, it's how we think about things that's so important. So I'll stop here, and thanks very much.
Fantastic. Many thanks to Allison Pollock. That was Dr. Allison Pollock speaking. And our next speaker is a fantastic Professor Luke Clemons, who is Cerebral Professor of Law at the University of Leeds. And remember quickly, do keep sending in your questions. Our panel will have a chance to respond to those questions in the second part of tonight's meeting. Thank you. Luke.
Thanks, Callum. Thanks, Alison, and thanks, Colin, and everybody. If Alison thinks she's gate crashed, I'm not sure why I'm here at all. I came here out of huge curiosity, really, because I don't know a great deal about the Scottish situation, only that everything in Scotland is much better than it is in this ill-served country of England. But I've been really impressed by what Colin and Alison, everything Alison says is right, and everything Colin says, well, not everything, Colin, because I'm going to take issue on some issues, and I'm going to get into deep trouble for what I'm going to say. So my background is I'm a lawyer, so that puts me at the bottom of the queue straight away. And I've been involved in writing about social care for 30 years, I suppose, as a lawyer, which is unusual. It's not a legally attractive field. I sort of come at this from a different point of view, and therefore I was hoping to sort of listen to the conversation rather than speak. I made some notes, but I didn't think I'd have to. So I may be reading some of these, but I come from this from a different perspective. I come from it, you know, I'm a socialist, and that colours everything I do. But as a lawyer, and having sort of been an observer of what's going on in social care, and really I'm a social care person, not a health person. I think we've got to start from the position of what's gone wrong. All too often I hear people starting from the solution. And so the first thing I'm going to say really is, why do we have to have a national care service? Maybe that is the answer, but that's not the problem. That's a solution, and I think we've got to define the problem before we come up with a solution. Very often in England, we're told it's got to be about integration. We've got to integrate with this wonderful thing called the NHS. Well, the NHS is very good at acute care if you've got a serious problem. It's pretty rubbish at long-term care of the elderly. We've seen the mental hospitals, we've seen the mental handicap hospitals, we've seen a lot of the abuses in funded nursing care. Maybe the NHS is not the model that we want if we're talking about long-term care. It abandoned long-term care and deinstitutionalized 30 years ago, 40 years ago. In England, not only do we have this thing about integration, but we also have this thing about IT, somehow IT, you know, artificial intelligence or robots or something, they're the solution. And the answer is, what are they the solution to? You know, what is the problem? And it seems to me the problem is a sort of, and this is terribly talking in, I think Marx might agree with it. There's been a complete market failure in social care. Social care has just completely failed. The way the NHS has not. The NHS hasn't had a market failure. It controls the market and it serves that market incredibly well, the healthcare system. It's underfunded, but it's still coping. So we've had a failure of the supply side. But only part of the supply side, because if you've got significant wealth, you have a very good system, a privatized system, and that's offshored, debt leveraged, and it's making a huge amount of money. But the sort of area that we're interested in is the supply side for people that don't have significant wealth. And unfortunately in England, that's dominated by, I don't know if it's unfortunate or not, it's dominated by people that don't have quite enough money to pay their way all the way. People, you know, the pressure for law reform in the UK of social care funding is about people having to sell their houses to pay for long-term care. It's not the 55% of disabled people who have no money at all, who are being charged huge fees put below the income level, charging. So I was very depressed when Derek was talking about charging. Charging is such a huge problem in social care, and whatever we have, we've got to get rid of charging because it is pernicious for people you know, medium and low incomes and poor people on below the wages. So the problem is we've got a supply side problem. And in England, 95% of the whole market is privatized. If you've got a problem, we privatized the system in 1993. And I think we can all say it's been a complete failure. It's had that time, the services provided to people on low income are largely insolvent. I mean, Allison and I wrote a paper for Tribune on this, and that most of the supply side problem for local authority support is insolvent. Only the really upper end of the market charging huge sums is doing very well, and that's largely being exported through offshoring and debt leveraging. So how do we address that problem? Well, what is the problem? The problem is that the quality is incredibly low. And why is the problem incredibly low, the quality incredibly low? Well, I think that comes down to staffing and problems of getting staff. As Colin has said, there's a sort of 30% staff turnover. In England, there's over 100,000 vacancies at any one time. Staff of having to go between various private caring opportunities, and of course that spread COVID as well. So we have to pay staff very, very substantially more. And when Allison and I wrote this paper, we had a sort of slight falling out about whether that had to be privatized. I mean, publicized, whether that had to be nationalized. And this comes to sort of the other problem is, as long as the staff are well paid and the money stays in the local community, isn't offshored or debt leveraged, is that part of the problem? Well, it's part of a different problem. It's part of a sort of fiscal problem rather than a local problem. I think in social care, you've got a sort of tripartite, a sort of a triangular problem. There's this tendency to integrate, to say and Allison is absolutely right, care is a continuum. But is it really logical to merge social care and dentistry? I mean, or I don't know whether there is a role for something different. But if you integrate it, you get all the huge problems of the NHS, which is crazy bureaucracy, managerialism, centralism, one size fits all. Now that's fine if you need emergency acute care. But if you need to live for the next 20 years in a setting, hopefully independent, you need a personalized service. Now, all the research is showing that you can integrate or you can have personalized services, but it's very difficult to have those two. And then you've got the other corner of the triangle, you've got choice. Now, I think in the NHS, maybe choice isn't really a key factor at all. I think it's overrated in the sense that, I don't want to choose my ambulance. I don't want to choose my acute care. I just want good quality. I don't want choice. But if you want personalized services, and I think that if we're talking the language of human rights, then the UN Convention on the Rights of Persons with Disabilities say that people do have those choices over long-term independent living choices. Then the NHS is not going to be the organisation that delivers that. That's going to have to be, I think, much more local. I think it's going to have to be part of local communities. In England, we would look to local authorities to do that. So there are really these quite complex trade-offs. Clearly, there's got to be a lot. The sums of money are actually great. Social care in England is less than 2% of the gross of the Chancellor Exchequer's budget. So if you raised 8 billion or something like that, which is peanuts at the moment, you could basically privatize it. You could nationalize it. I would, if I wanted to get quality, I probably would keep it local and smaller. Have the way that we're told in England, it would have been much more effective if local public health services had been at the forefront of testing and tracing rather than Serco, or indeed the NHS. So I think there's a really strong argument for a national but locally run care service where personally, I would allow the not-for-profits. And in Wales, as you know, the government there have enacted in legislation keeping the not-for-profits within that system. And I'd have to have very strong ideological reasons to suggest that that was a bad idea. I would, of course, exclude for profits from this business, as Colin has really powerfully said. You know, that's a sort of entirely inappropriate choice. And how much it costs, I don't really mind. I don't know, actually, to pick you up, Colin, again, and I'm really going to regret this. Maybe it does cost 70,000 quid to have a decent care home. I don't know. If you pay care workers and you have proper staffing, maybe paying them would cost 70,000. That money would come straight back into the local economy through taxes, through decent pensions and things like that. You know, the average heart operation, I'm told, well, Alison will know better than I, but I was told the other day, the lifelong cost of a liver operation was £1 million quid. You know, these are big-ish figures, but, you know, we don't have that many people in nursing homes. I'm sure the average cost of somebody in a hospital bed is way over that figure. So I think we don't need to really worry about the cost, because we know it's not expensive compared to a lot of other issues. We need to focus on costs, and that, I mean, we need to focus on quality and supply, and that, it seems to me, crucial to that is giving really good terms and conditions to the people that work in that system. And once you've got that right, a bit like with the NHS, and you've got your recruitment right, then it costs whatever it costs. Because the other thing that was said when I was sort of doing my parliamentary stuff was that, can we afford it? And the answer is, as a nation, we already do pay for it. It's just that quite a lot of people have to sell their houses and everything. Their whole estate disappears down a hole paying for these care homes. It's not as if nobody, you know, the cost is borne, but it's borne unequally, if you see what I mean. So anyway, I've ranted on, and now you can put the boot into me.
Fantastic. Thank you, Luke, for those comments there. I think a fantastic sort of debate, discussion going on here across the board. A fantastic panel and some fantastic questions and comments coming in, spurred by our fantastic panel there. So just to keep you what's going to happen. So you've all of you watching at home, you've been sending in your questions. I've been watching those questions coming in, and I've grouped them together into kind of 3 themes, which I think seem to keep coming up. So I'm gonna group those together, and I'm gonna put to our panel 3 questions. We'll take them in reverse order. So we'll hear from Luke, then from Alison, and then from Colin. That'll probably be all we have time for. So I'll group those questions together and give them a chance to respond to all 3 together, since there might be different elements, say, we want to pick up on differently. But just to give them a bit of time to mull over those questions, I'll give you the questions just now, and then there's 1 or 2 other announcements just to make. The first sort of theme, the question I think has come up a few times is how there's I think a broad consensus across the panel that this should be publicly owned. It's obviously what we hear for a case for a national care service, but there's been a number of questions coming in about, for example, how might we best want to organise this? And I think this has actually come out since this question has been asked as well from the panel. Should it, for example, be organised through local authorities or through the NHS, or completely separate or broken into health boards? You know, how might we want to go about that? Obviously, we don't need to have concrete conclusions tonight. That is just one part of a much broader discussion, but it'd be interesting to hear the panel's thoughts on that. But a couple of questions there. This idea of how do we make balance kind of the local with the national. Another question that's come up a few times is making this point that the National Care Service could have huge benefits for so many folk, for residents, in terms of the financial pressures on residents and their families, in terms of the conditions of staff, and indeed taking a lot of pressure off a great many unpaid carers who might be faced with kind of the pressures of care, as well as the financial pressures that can go hand in hand with that. And one question that's come up a few times is this element of how can these sort of material changes, how could they help feed a change in the culture of care? For example, to kind of restore kind of the dignity, the respect, the role of carers in society. It's an important and powerful role in society that perhaps certainly doesn't get the respect it's due. How can we can help, you know, keep that respect and dignity for residents, staff, and carers all together? And the final one is much more succinct. How do we win? A few folk have made this point about, in terms of making, you know, the next steps. How do we keep, you know, building this conversation for a national care service? How do we move forwards closer to winning and achieving a national care service? That's a question that's come up in different forms. So I'll just to give this panel a minute or two to mull over those questions before we ask them to come back in for 5 or 6 minutes or so with each of those. I appreciate big questions there, a short time, but we'll get a fantastic contribution, I think, from each of our speakers there. So in a moment, we'll hear from Luke and from Alison, and we'll finish with Colin before I'll give a few final remarks. But just while they're mulling, very briefly, I think it's worth saying that events like tonight do not just happen out of nowhere. Besides our fantastic guest speakers and our brilliant tech team, credit has to go for tonight to the members and activists of the Lothians branch of the Scottish Socialist Party who've hosted tonight's forum. As has been mentioned, the SSP has been campaigning across the country on this very safely and socially distant but passionate campaign on this subject, and is also commissioning a series of polls on this very subject coming up in the next couple of weeks, months. Winning real reforms and building a better Scotland are both possible, but it's up to all of us to make that happen. If you'd like to get involved in building the case, building that campaign, join the conversation, there's no better way than I can think of joining the Scottish Socialist Party. Either join online or at one of our stalls, or even simply donate, again, either online at one of your local campaign stalls across the country. I'll hand over back now to our guest speakers to respond to those 3 questions about accountability, organisational structure, about the culture of care, and then finally, how do we take this forward? So like I say, 5 or 6 minutes to each speaker, and I believe that'll probably take us to about time. So there'll be a few final announcements at the end, and then we'll wrap up this stage of the evening's proceedings. So without further ado, I'll invite our first speaker back, Luke Clemons.
Okay, the last one's easy. How do we win? It's inevitable. That is the only solution. We have tried everything else. We've tried privatization, we've tried fragmentation, we've tried consumer purchasers splits. There is no solution apart from a national system whereby the risks of care are borne by the state. That's the whole point of a state, basically. So I think it's inevitable. I'm not very good on predicting when. I always think it's going to happen in a year or two, but I've now got people that remind me that I was saying that 15 years ago. So I think inevitably there is no other way. We've tried everything else and we've been fleeced and it's been done badly. I think just want to make 2 other points. So first of all, I think we've got to revive the power of local government. We've got to start them being really powerful players with respect and dignity and incredibly well funded. But as a sine qua non, as a sort of essential element to that, they have got to abandon this managerialism, this complete command and control, organizational freakery. And Derek was talking about targets and measures and things like that. We've got to delegate to frontline staff. We've got to empower them. The way I think, in a way, GPs are slightly empowered, that they can make decisions and people will respect them rather than just sort of putting them in a straitjacket. And once we have got rid of that awful managerialism and budgets, then I think that the system will work. And I don't think the system will be expensive. I think the key point you just said, Callum, and I think it's and some of your questions is that we just mustn't forget not only undercompensated care workers, but uncompensated carers. Every year 2.3 million family members give up work to provide care because the service is failing. And that's a huge hit to the UK economy. 2.3 million people out of work, in poverty, often without any chance of a decent pension. And we've got to face that's gendered. Caring is not equally done between the two, between genders. Men do care, but much more hard care work is done by women. And if we are not prepared to fund the care system properly, then basically we're advocating discrimination against women. I mean, direct discrimination, let alone indirect. So this idea that the state withdraws and family do it. It's not family, it's mothers, sisters, daughters that do it. That's me.
Fantastic. Thank you, Luke, for answering some of those questions on behalf of our audience. And I'll continue to put those same questions then next of all to Allison Pollock.
I'm sorry, I didn't have a pen, so I didn't write them down. But I think, I actually think this discussion is very, very important, because I think the differences between us are probably not as great. Can you see all right? Sorry. I think the differences between us all are not as great as we think they are. And I'm very sympathetic to Luke's position, because one of the issues is, for me, care is a continuum, and we have to decide what those functions, you know, our vision, which is universal health and social care for all, from publicly funded, with no charges, publicly accountable to local people. And I would go for public provision, and I'll come back to that, but I understand why Luke's saying what he is. And for me, the big problem, and here I agree with Luke, we need an analysis, because what has happened is that local authorities have been completely hollowed out, and all they've become is privatizers. So you would not want to give social care to local authorities in their current state. I mean, they've lost control of schools with academy schools, they've lost control of everything, almost everything, and they just privatize. And we've seen the same for the National Health Service. It's increasingly centralized, not as bad in Scotland as in England, where it's totally fragmented. And we've lost, you know, the vestiges that we had of local accountability and local services. Because in a market, what happens is that local services become uncoupled from their communities. So I've got great sympathy for Luke, and I think this is one of the issues. We have to decide on our visions and principles and the functions and where they sit, and then how things are organized. And so I'm with Luke in terms of wanting to have a democratic tier that is not central government. You want central government to do lots of things, so funding, oversight, you know, ensuring equity, monitoring, you know, there'll be lots of other things that they need to do, but it's a bit like infectious disease control. The big mistake the government's made with COVID is centralizing everything instead of deciding which functions would be better sitting at local authorities, like infectious outbreak control. So I think we have to have I think this is a really important start for a really big debate and discussion, because I think what we want is not very far apart. What Luke and I want is services for people that they feel they've been involved in, that they have a form of community ownership and control and accountability, and not the extraordinary powerlessness that staff and carers and relatives and friends and all the residents feel with these diktats about you can't go into a home, you can visit for half an hour, you can only go outside. I think this has been incredibly disempowering, and we all feel very disempowered. And it's really profoundly anti-democratic, as well as being profoundly against our human rights. So I don't think there are very many differences. I think we need to work these out. I think this is where we have to think, what are the functions? Where do they sit? Where are the responsibilities? How do we strengthen local accountability? How do we at the same time have national terms and conditions, national workforce, national quality, national staffing? And if we're going to have any kind of not-for-profits, then, you know, we need to make sure that 80 to 90% of the budget is spent on staff, which it was under the public system. But currently we know in many of these care home operators, the private ones, it's less than 40 or 50%. Now, we don't know what happens in this country, but we know from the US, where there's much more transparency, that the bulk, you know, over half of the budget is spent on bureaucracy, administration, billing, invoicing, and profits. So this is why it's really important that we know where the money's spent, and we have to have systems of accountability so we can track it and trace it. Now, with goodwill, we can do all this, and I don't think the differences are very great between us all when we sit down and discuss it. And I think that's where Luke comes back to needing an analysis of the problems. The NHS is not at all perfect now. I think it's had so many changes. It too needs to be reformed and improved. But my real worry is by leaving a very vulnerable workforce, 1.5 million, outside of the NHS, which is properly unionised, has a lot of force and a lot of teeth still. That is where my worry is. And I also think it's really good for doctors like me and junior doctors and nurses to actually have experience and time working the most frail and elderly people, being part of that on rotation, rotating in and out, so that we understand the continuum of life and death and dying and care and long-term care. So carry on. This is a really important project. Keep it going. And I'm delighted to have been invited tonight, and really delighted to have shared it with Colin and Luke. So thank you.
Thank you, Alison. That was Dr. Allison Pollock, one of our speakers tonight. And our last guest speaker tonight, who'll be again answering some more of these questions for you that we've come up with tonight, is Colin Fox from the Scottish Socialist Party. Colin.
Thank you very much, Callum. And I would just like to say that to Alison and to Luke, that we're delighted to have you. We're delighted the contributions you've made here. There's only one issue. Luke suggested there was a big elephant in the room that we were going to have a debate over, and the elephant turned out to be a mouse in this regard, where you talked about understandably living in the University of Leeds area, wherever you live, Yorkshire. My in-laws are from Sheffield. You understandably look towards Scotland and feel the grass is greener up here, perhaps because we don't have NHS prescription charges, perhaps because we've had free personal care for the elderly since 2002. Unfortunately, when you get across that border, you find that the grass isn't as green as you might think it would be. And Alison does us a favour to remind us that only 10% of our care home residents who tested positive got into hospital. You know, that sometimes Scotland is an awfully callous country. The Scottish Socialist Party lost our national treasurer last week to COVID, and we're heartbroken about the circumstances he found himself in, we found himself in. And you both of you, I'm sure, would not be surprised to know that Scotland as a country is horrified that half the people who've died of COVID here died in the way that they did, relatively uncared for, from COVID in care homes. That's not the image we want of our country from people who live in Yorkshire or anywhere else. So that's the only minor thing I'd say. With the only point of dissent, I would say, look, I think the contributions you both made were terrific. And as the last speaker, I get to steal some of the themes that you say and develop them a little. And one of them is, and I'll try and answer the 4 questions that Callum has asked the audience out there and Zoom land has asked us to address. But to Luke and Alison in particular, who have much greater experience and knowledge and thoughtfulness on this question than I, it's a constant for us in the left to say, we want a national health service like we were promised in 1948. The National Health Service, I'm afraid, is a class-ridden institution. I see this all the time. Working class people are intimidated by the professionals inside the NHS in a way that the middle class never are. It's not seen as our service in the same way. It's not seen as the service that was promised to us by Iron Bevan in 1948. And we remember, and young socialists like I used to be, I'm now, slightly older socialist, but I remember being taught by, men and women who taught me in my socialist understanding of the great failures and mistakes that an Iron Bevan made. One was to, and I quote him here, to stuff the consultants' mouths with gold. We had reluctant doctors here who didn't want to be part of this National Health Service. To them, it was communism after the Second World War, and they had to be getting their private patients. They had to keep their private patients. And I have to say, it's a big failing of the National Health Service. GPs being private companies, privately individuals, you know, dentists who are privately paid. These should be salaried employees of the NHS. The NHS is the biggest, you know, employer in, I think, in the world after the Chinese Red Army. It's got many deficiencies in it. That's one of them. And perhaps the biggest is what you and the three of us and others on Zoom line have been considering. The National Health Service is not democratic. It's unaccountable. If the final say-so is with the minister, as an MSP 4 years at Holyrood, I was constantly involved in campaigns to overturn decisions of health boards, to withdraw services from St John's Hospital in Livingston that the people wanted to retain there. So we're left with a scandalous position that if there's a crash in the M8 at Hart Hill, then they drive right past St John's Hospital in Livingston, 30 miles round the bypass to the Royal Infirmary in Edinburgh. That's but one example of where this is not democratic. This is not accountable. This is not controlled. This is, in effect, chief executives. It's a structure that's wrong. And without getting into that, because I'm not in territory I could possibly compete with Luke or Alison's understanding, I simply turn the question around and say, I don't want a national care service. It's some replica of the NHS. Not on. No, not at all. I don't even, and I think Luke does us a service by saying, I don't think socialists should argue that they should be hermetically linked, that the NHS and the care and health and dentistry should be completely bound together. No, they should be complementary, but joined together in the sense that they're free, and they're free for socialists like us. The reason we argue it's free is that's the one way you guarantee its accessibility and universality. Alison mentions that there are care homes where you're paying, and she quoted figures that account to £90,000 a year. And £90,000 a year means that the vast majority, 99% of the population, can't access them. That's not a public service. And that's not even a question of choice. There's no choice there. That's Hobson's choice. You've got no choice whatsoever. So I definitely want to see socialists like us, people on the left, intelligent, thoughtful people thinking, we need to come up with a democratic structure to the National Health Service and to the National Care Service. And it strikes me that you look at the mayors, we don't have any elected mayors in Scotland. First of all, they would be provosts. But anyway, we don't have directly elected mayors. But there's nothing wrong with the idea. In fact, there's plenty right with it. Maybe there's a case for directly elected, you know, local care lieutenants, call them what you like, right? You know, there's a structure there where people can directly intercede and say, we don't like this decision. We don't like the way that decision's taken or the direction of travel, and we want to intercede in it. And I have to say, for the audience at home, I first came across Allison Pollock's work, tremendous work, over PFI. I went painting, whitewashing paint. That takes you back to days of the social media. I had a bucket of whitewash and I painted the old Dalkeith Road when the proposition was raised that they were going to build a new Royal Infirmary in Edinburgh on the site of Little France, and it was going to under a PFI. And as Alison has pointed out, here was a hospital that we could have got, paid for the NHS 300 million, but it's going to cost us £1.4 billion after 25 years, and it still doesn't belong to us. It's daylight robbery as well as an insult to everything that we stand for. And so PFI, the National Health Service, got badly wrong. We get lots of bad things wrong. This opportunity that we're in just now, I think COVID, you know, they talk about unprecedented times. Well, this is an unprecedented political time. And out of it, it's almost like it's the end of World War II. It's a period for change. It's a period for not going back to the way things were in March and say we need a fresh start, a fresh look at this, an improved look at it. And one of the things I'd certainly agree with my two colleagues who spoke is the condition of staff in the care sector and the condition of residents, the treatment, you know, the care, that's the word I'm looking for. The care, my mother died 2 years ago from dementia. She was cared for at home. I couldn't speak highly enough of the carers that came, the dedication of the staff, the things they did way beyond the care of duty. But I knew that they weren't getting paid when they left my mum's house to go to their next call, 20 minutes away in the car. They didn't get paid when they were traveling. The conditions are shocking. They're shocking. They're absolutely shocking. They're a scandal. And that's why I referred it to Dickens this time. The care is not sufficient. And Derek, I beg your pardon, Luke and Alison talks sufficiently about the improvement and care for the residents, for the, the recipient, we need to improve greatly. But for the staff themselves, I listened to a programme, I don't know if you heard that Andrew Marr was on Start the Week, and Madeleine Bunton, the author of Labours of Love, and Jeremy Hunt were on the programme. And 2 points that they left me with was, Madeleine Bunton raised the point that Luke did about how we've got a ageing population, so the demand for this service is going up and up and up, and the number of people providing the service are going down and down and down. We've got a ticking time bomb here. And amongst the solutions that Madeleine offered was, we've got to do something about the culture, care workers. And she talked about, we've got to do something, this is quite radical, we've got to do something about young men and persuading them that this is a profession that they should go into. This is a profession for them. This is highly rewarding, looking after other human beings. It's not economically rewarding. That's a point that we have to fix first. But Madeleine Bunton talked about how the American poet Walt Whitman, he gave care during the American Civil War. He talked about how in the time of Florence Nightingale, she was a nurse in the Crimea where all the other nurses were male. It was a war scenario. And so we've got to change the mindset of young men to say this isn't an occupation for women, because they dismiss it that way. And women are receiving end, therefore, of poor conditions, poor care, poor culture. And Jeremy Hunt talked about there would be an extra £10 billion cost to the NHS if we're to increase or to cope for the present demand and increase the current staff wages to £10 an hour. It cost an extra 10 billion, and that's what he said would be the extra cost. And my view was nowhere near enough. £10 an hour is nowhere near enough. We need to put in a proper career structure. I meet when I'm campaigning lots of different carers, men and women, and they talk to me about how they've been 20 years in the service. And you think, well, where are, they should be in supervisory roles, they should be encouraging others, they should be in career development roles. There's lots of other things to be doing, and Madeleine Bunton's book talks about that a great deal. So the answer to the question of how do we cope for future demand is we've got to encourage young men and young women and not so young and join this profession. And seeing the submission that I made to Derek Healey, I came across this quote from the Bank of England's chief economist, Andy Haldane, not somebody I would normally quote, I have to say. He doesn't seem to be in my coloration politically. But he's talking about the biggest potential growth areas for the human race in the future decades is in the care professions. And he said, wouldn't it be nice if Oxford University, what would Oxford University look like if emotional intelligence was at the heart of all its degrees? Instead of coming out as a lawyer, with due respect to Luke, and coming out, as bankers and all the things that you come out of Oxford University or even other academics, which is a double insult to Luke. But we should encourage young men and women to take care, empathy. That kind of intelligence is overlooked and too little considered. So the last thing I wanted to say was that question of how do we win? And here is where, between us all here, at least the three speakers, we've got, 100 years or more of experience to call on. We can think of how did we win the National Health Service? And dare I quote somebody, I just quoted Andy Haldane. Let me quote Boris Johnson, who yesterday said, how are you going to persuade the women at the EU to his point of view? And he talked about the power of reason. Well, of course, he's right. And as Luke and Alison have said, the power of reason is on our side of this debate. This current model has failed miserably, abjectly. It fails everybody. It fails us as taxpayers. It fails the recipients of care, the staff. So we have the power of reason. And on top of that power of reason, we've obviously got to mobilise public opinion. We've got to mobilise the electorate who are in Scotland. We have a Scottish Parliament election next May. And if in January, Derek Healey's review comes out and it's seen as a whitewash, or it talks far too narrowly about human rights without addressing the fundamental human right is the right to life itself, the life to proper care. And if there's any sense that review is a whitewash, or that Nicola Sturgeon is not going to deliver the reforms that the care service needs, I strongly suggest and suspect that will cost Nicola Sturgeon, and it could well have an impact in next year's Scottish Parliament elections. But it's not just about those elections. We need to mobilise opinion on the streets and the doorsteps and communities and unions and all the other organisations that working people feel passionately about and the need for change. And I say, I look at Luke and I look at Allison and know we are constantly the optimists. We're optimistic for a reason, because we're optimistic about, we see the need for change, and we're optimistic about the ability through the power of reason to mobilise that constituency. Then I've been really, really encouraged the last 6 months on Princess Street and elsewhere when I've met people, when you explain to them what's happening and the penny drops about how this isn't just a right argument. This is a material question for all of us. I'm 60. This is a material question for me. And for the baby boom generation, we're approaching the need of care services rather more urgently than other generations. And that encourages me too. Thanks very much, Carl.
Fantastic. Thank you, Colin. And thank you also to Alison and to Luke. I think a really informative, really fascinating discussion tonight. And there's obviously a number of questions that have come up we don't have time for tonight, I'm afraid, such as we've had a few points about the private profits that take public money. How is that working at the moment? And also about the potential role of the third sector alongside existing and prospective future models of care. I'm afraid we don't have time for those questions tonight, but those are ones that we can carry over to any future parts of this conversation. This is absolutely an ongoing discussion. I think both times, both tonight and last night, we've had some really fascinating discussion amongst our panel, always a real consensus around that heart of that vision of a national care service. I think one of our key aims of these forums is to explore the case for the national care service and really open that discussion up to as many people as possible. But the other, I think, really shown in that kind of discussion, it's about keeping that conversation going so we can together build a living, breathing model of care that draws the best from all these different perspectives and delivers to everyone in Scotland dignity and respect, both in work and in care. Alas, that is all we have time for tonight. So many thanks to our guest speakers. I've been delighted to have on our panel tonight Colin Fox, Dr. Allison Pollock, and Professor Luke Clemons. And also thanks to Derek Healey for his video contribution at the start. I'd also like to say many thanks to our tech team, to Hugh and Graham and the Lothians branch of the SSP for hosting tonight's forum. Many thanks also to all of you at home who have tuned in tonight, sent in your questions and joined that conversation one way or another. And a final reminder, you can join the SSP or donate online. There is also an online shop on the SSP website, including the fantastic Internationale tartan scarves, I've got two, and a range of apparel, which makes great Christmas gifts in this particular season. I've been Callum Martin. Thank you for tuning in and good night.
Thank you, Luke. See you soon. Thank you.
Thanks very much. That's great. Really interesting. Lovely.
Thank you very much for your time.
Thank you.
Best of luck.